So there's several different types of knee replacements that kind of all get lumped in a certain category. There's what we call partial knee replacements, where we only replace one part of the diseased joint. There's also total knee replacements, where we replace all what we call all three parts of the knee, underneath the kneecap, inside and outside of the knee. That's the most common procedure by far. And these surgeries, a variety of ways of performing them. They can be done with traditional mechanical instruments, where we align them by putting rods inside the bone. They can be performed with computer assistance, where we measure intraoperatively the bones and use a computer to help predict the proper alignment and position of the implants. They can be done with robotically, where a robotic arm helps assist in the cutting. They also can be done what we call customized for patient specific. So we plan the surgery ahead of time, make some custom molds, much like a dentist would for a crown on a tooth, and then at surgery, just put the molds on and enact the plan. So there's quite a variety of different ways. In the end, they're all trying to accomplish the same thing, which is just resurfacing the diseased part of the bone so that people can move. When you do move, you're not moving bone against bone, and so you're not having that pain with movement. But there are a variety of different techniques. There's also muscle sparing techniques where the muscle isn't cut. Those are the type I prefer, versus techniques where traditionally the muscle's kind of cut and the tendon's repaired. So a variety of different methods. In the end, most of them just try to accomplish the same thing. Some appear to be easier to recover from than others. Some appear to be more accurate and precise than others. But overall, the implants are very good and the procedure is very good.